Good afternoon. This is Dr. Do again. Good to see you. This is the quarantine special edition, video number 5. The topic is the metabolic syndrome. We have mentioned in this category of syndrome, including different kind of diseases like hypertension, diabetes, hyperlipidemia, obesity. I think we have talked about the hyperlipidemia, obesity, hypertension. Today we're going to talk about another disease, which is diabetes. This is so common. You have heard many times. I'm sure you do. You probably know a lot about this because it is so common. And I just like to talk some fundamental knowledge and how the body works in order to prevent it. And in case you had it, how to manage it in a way, in an efficient way, and work well for you and for the physician. So in order to understand diabetes, let's start from the important organ. In my other set of video, I mentioned about the solid organ in the abdomen. One of them is called pancreas, so you probably know that. Pancreas is a very special organ in the body. It belongs to endocrine system. It's a very soft, fragile organ. It has endocrine, exocrine function. It's majorly make a lot of digestive enzymes to flow into the duodenum, to digestive system, to help digest the carbohydrates, lipid, and protein. This is the exocrine function. The endocrine function, pancreas has millions of those small islets, and in that islets have different type of cells. For example, the alpha cell, and the beta cell, and delta cell, etc., etc. The beta cell is the one that secrete insulin. What does insulin do? Insulin is the very important hormone to lower the blood sugar. How? Insulin can tell the body, tell the muscle, tell the fat tissue, hey, I have a lot of glucose in the blood, take them and get rid of them. So that's basically what insulin does. Okay. In terms of if the pancreas function is not well, we cannot. For example, if somebody had diabetes type 1, which means the beta cell cannot make insulin. So that kind of patient has the diabetes. They rely on insulin lifelong. I'm going to talk about today's the other kind of diabetes. It's not beta cell does not function. Beta cell is fine at early stage. The insulin is fine at early stage, but the peripheral organ does not respond. So the insulin will tell the muscle or the fat tissue through the receptor, tell them, hey, we have the body has so much glucose, take them. But in this type 2 diabetes, those receptors does not receive the signal or does not respond to the signal. Whatever insulin or you said, I did not hear it, I'm not going to respond it, so you still have your glucose circulating in your body. So that's the type 2 diabetes. Sounds fascinating, right? And then you have those high sugar circulating in your blood. What can the sugar in the blood? Why it's bad? You probably ask, we need sugars for energy. Why the sugar is bad in this case? The sugar in this case is bad because it's damaged the small blood vessel first in the organ. Okay. In addition to increase the viscosity of blood, it damaged the small muscle, micro arteries. So then the small microaneurysm or block the small blood vessels, cause a lot of problem. The hemorrhage, and impaired nerve function. So that's what it is. Why it is bad, the glucose in the body. Okay, so why some people has it, some people don't. Why? Because it's not genetic, it's not like type 1, genetically determined, happen in young patient. Why this type 2 or diabetes, somebody has it at the middle age, somebody don't. There's some predisposed genetic causes, genetic risk running in the family. So that's one of the reasons. The other reason, like obesity, you already know it probably, overweight. The body cannot process those extra sugar, or the kidney problem. The kidney cannot get rid of those sugars. So this is the risk, the cause for diabetes. And in terms of diagnosis, you know it. You probably, your physician talked to you so many times. Do you want to do the test, or after 40 years old, you do the regular physical, your blood is drawn and sent to the lab to test whether you have or do not have the high blood sugar. Okay, so this is very easy to diagnose. Or the physician, the lab come back is borderline, you may or may not have it, and the doctor will give you another test called the glucose challenge test. You drink a cup of loaded sugar, and then they draw the blood to test whether your body can handle this kind of sugar, let you know whether you have diabetes, pre-diabetes, or you don't have it. Okay, so after you have your diagnosis, for example, after you diagnose diabetes, doctor probably already communicate with you, hey, your blood sugar is high, you need to do this. The best way, the first way to start is exercise, healthy diet, see whether it can be managed. Because you don't like to jump in the medication at the first, as a first measurement or the first way to treat it. And your physician doesn't not want to do it either, so ask you to do this and come back 3 or 6 months later and recheck your blood sugar. If it's getting better, that's good. If not, then we'll start medication. What kind of medication? This is not in the in terms of medical management of diabetes. It's not going to be in this video, because different physician has different preference. Use what kind of medication. I just talk in the purpose for this video is education and what you can do to facilitate with your physician management. So like I said, exercise, health, diet. These are for those middle-aged people. I just have a brief message for younger people. Start early. If you watch this video, you're young, just make sure have this in your idea. Try to limit stress and limited sedative lifestyle, exercise, manage body weight, healthy diet. This is in long run will prevent many problems. So start from early. Okay, so this is briefly introduction for diabetes. I hope it helps, and I hope my message is clear. Okay, thank you for tuning in, and see you next time.